This is my patient Michael. Okay. Hi Michael, how are you today? Great, that's awesome to hear. So tell me, is there any concerns about your oral health you'd like to mention to me today? We can discuss or that I can help with. Tell me more about that. Okay. Are you willing to change some habits about that? Can you tell me about your home care routine? What do you do regularly to clean your teeth? Okay. Okay, and is that difficult for you to keep up with? So it sounds like you'd like to change your routine a little bit, like you'd like to change the current health of your gums. Yeah, so it sounds like you'd like to clean the crowding of your teeth a little more. There's that plaque buildup we discussed. Okay. And the bleeding, yes. You'd like to reduce bleeding. Okay. Is there anything else I'm missing or anything else you'd like to talk about? Okay. I appreciate your willingness to hear about some home care products. Okay, based on our assessments and intraoral finding, there are personalized home care instructions I would like to share with you. Would you like to hear about some things that you could possibly try and implement in your home care routine? Okay, perfect. Okay, so tell me about your current home care routine. What do you use to clean your teeth and how often? Okay. Okay, so basic things. What's one thing about your health, your oral health, that you'd like to work on the most? What are the most important reasons for improving your oral health? On a scale of 1 to 10, how important is it for you to make this change? A 9. Okay, so it sounds like you just overall want to learn more about how to improve your oral health, and it is important for you to keep your teeth? Yes. Your plaque assessment, the past score findings that we discussed earlier, indicates you tend to build plaque along the gum line in between your teeth. I will introduce and demonstrate home care tools tailored to your oral care needs, including the best toothbrush and aids to clean between your teeth. Our gums fit the teeth like a turtleneck collar fits the neck. Every tooth wears a turtleneck collar. Both good and bad bacteria live under the collar. If we get rid of both, it upsets the mouth's balance. So how do we get rid of only the bad bacteria? The bad bacteria are anaerobic, meaning they thrive in the absence of oxygen. All we have to do is expose them to oxygen. It takes bacteria 24 hours to create an oxygen-free environment or a bubble around themselves, mostly inside the collars. In the oxygen-free environment, bad bacteria eat the sugar that comes into the mouth and secretes an acid byproduct. The acid eats away at the gums and attachments of the gums of the tooth, making the turtleneck collar deeper. Bacteria in plaque and tartar, which is calculus, buildup also acts like a sliver in the gums, causing swelling, redness, and bleeding. Just like if you had a sliver in your hand, you would want to remove it and keep it clean to clear up the infection. There are many ways to remove the bubble and oxygenated collar, including toothbrushing, flossing, brushes that go between your teeth, and that is all. The home care tools I will show you will help remove the bad bacteria in the turtleneck. Oral health is tied to overall systemic health. Strong disease-causing bacteria from the mouth are swallowed all day. They enter the bloodstream and affect other parts of the body. Research shows links between inflammation caused by oral bacteria to increased risk of heart disease, stroke, cancer, diabetes, autoimmune diseases, Alzheimer's, low birth weight, and preterm birth, etc. This is why removing bacteria and buildup is important. Okay, so for your toothbrush, brush the gum line as though you are making soap suds so oxygen gets into the turtleneck brush. The brush gets everything except in between the teeth. Toothbrushing, I recommend a soft bristled toothbrush. Manual is fine, but an electric toothbrush is actually better for getting a deeper clean than a manual toothbrush. They are a bit pricier, but it is a worthy investment. Manual toothbrushes actually remove 50% less plaque than an electric, so something to look into. Okay, so you want to brush the gum line as though you were making soap suds so oxygen gets into the turtleneck. The turtleneck is right here. And the brush gets everything except in between teeth. And that's why we floss. If there's bleeding, you know the bubble has not been removed and it is a sign of undisturbed bacteria around the gum line. Okay, so as for flossing and proximal aids, there's lots of options. So when you floss, you want to take like a 12-inch strand, wrap it around your pointer fingers, and then hold them with your index and finger and thumb. And then you just want to do a scooping motion between each tooth. If there's bleeding, you know the bubble's not been removed and it is a sign of undisturbed bacteria between the teeth. Another home care aid you might be interested in if flossing is difficult for you is the interproximal brush. This one will help you get those far back, hard to reach areas in between any crowding. And you would just like scrub this between your teeth. I appreciate your willingness to consider these home care recommendations. I think we have created a great home care regimen for you. Do you have any questions about the home care tools I recommended? Okay. Which tools do you like the best? What is one thing you would like to work on until I see you again for your next free care appointment? Okay. Alright, so you learned about tissue bleeding, the significance of it. Yeah. You really like the interproximal brush, that's good. Yeah, I can definitely show you places you can get that. We can look it up right now. You'd like to try to floss more as well? Perfect, that's great. Something to try would be a water flosser. I don't know if you're interested in that, but it's kind of an easier way to get flossing done. A little more pricey though. Okay. Alright, I will check in with you at your next free care visit. And we'll see how these products are going for you. Is there anything else you'd like to consider? No? Okay.